So we're going to clean the skin first. If you want to get comfortable so your head can be on the bed, and we're using Spectracept to clean the skin, which the basis of which is hypochlorous solution. So it's a really good antimicrobial. So we just give that a wipe.
Kills bugs.
Kills bugs on the skin. And then we're going to mark the areas that we want to inject. So if you can frown again. So I'm just marking the procerus muscle and the corrugator, so the head and tail of the corrugator muscles above the brows. So just frown. So you would explain to the patient that you might get red bumps that look a little bit like wasp stings. That should go down in about an hour. That you might have a bruise, and bruises can last 1 or 2 weeks before they fully resolve. That I wouldn't want you to touch the face today or do any exercise today. And beyond that, I'd want to see the patient in 2 weeks for a review to check the results and add more product if necessary. Any questions?
No.
No. Would you like a ball to squeeze?
Please.
In this case, my heart-shaped ball. So I like to lie the patient flat because that helps dilate the veins and it means you're better able to avoid giving a bruise.
It's quite relaxing so far, Fiona.
Normally I have music on in the background, but we won't. So I've got my 1 ml syringe, and actually I'm using these new invisible needles, which I find are really beneficial at sort of decreasing patient discomfort. Small scratches. So close your eyes. So we start again with the procerus, and we're going to just inject 4 units into each injection point. So that's the procerus. And then we guard the orbit as we inject the corrugator, and we inject along the length of the muscle. So any diffusion goes along the length of the muscle. Sometimes the tail of the corrugator, I think, is a little bit more pinchy. Again, other side. Frontalis, I'm going to aim upwards, so any diffusion goes up. And I just like to use my finger as a little bit of a prop. So again, we're going to do 4 units at each placement. And the important part here is that you're at least 2 centimetres away from the lateral brow.
I think that needle is much better.
Yeah, so we used to use 30 gauge needles, which are the needles suggested in the product information. Then we moved to 33 gauge low dead space, but these are even smaller and shorter, so they're not as bendy, and I just think they're much more comfortable for the patient. I think key is you see the patient for the review. If you need to adjust the treatment, you learn from the patient's anatomy how you need to adjust it so that each patient gets an individual treatment plan. It's not one size fits all. There won't be any bruising. You can just see the small red bumps under the skin.
Oh, thanks, Fiona. So now, what am I going to notice now?
You're going to notice the bumps going down, and then you shouldn't notice anything. But by day 3, you might find when you try and frown, there's less movement in between your brows.
So I should notice these, they're called the 11 ones.
Yeah.
These ones are going to go
will be
down.
less deep when you frown.
Nice,
And when you raise your eyebrows, again, these should be less steep when you raise your eyebrows.
And these are going to be the same.
They're going to be the same. And these are still going to be here, but they're just going to look a little bit smoother.
Okay. And we'll report back in
2 weeks' time.
Thanks, Fiona.